My name is Alberto Giubilini, and I'm based at the Oxford UEO Institute. I'm a philosopher by background, and I work mostly in public health ethics and also in bioethics more broadly. My research so far has focused mostly on the ethics of vaccination and also on the ethics of public health restrictions during the recent pandemic. But I also work on healthcare ethics and medical ethics more broadly. For example, I just finished writing a book on conscientious objection in healthcare. And my future projects are about the issues around fairness and freedom in public health policy. So I want to inquire about how freedom restrictions are distributed across people and across groups in different types of public health policies in a way that is fair to everyone and is also effective from a public health perspective. So to me, the medical humanities are really about the values that inform our approach to healthcare and to medicine. It's about the human aspect of healthcare and medicine, as opposed to the merely scientific and technical aspect. And I think this is an important area of research for a number of reasons, but mostly because clinical practice and also public health policies are often imbued with ethical and political values and cultural norms that are often left implicit, and people tend to use phrases like we should follow the science or these kind of things, as we have seen during the recent pandemic. But I think this is problematic because by speaking in this way, we fail to acknowledge the number of values and ethical and political values that are at play when we make decisions, both about our own health, but also about the public health. For example, within the healthcare practice, we often see conflicts of values between doctors and patients in cases such as, for example, abortion, end-of-life decisions, and in general, in the case of controversial procedures, medical procedures. And the tendency is often that doctors know best. And there is a lot of confusion around this idea because, of course, doctors know best about technical aspects of medicine. But there is often the risk that this technical, like medical expertise and medical authorities translate into a kind of moral authority where doctors tend to either impose their values on patients or assume that the patients share their own values. And this is often problematic because conflicts frequently arise, especially as healthcare policies become more liberal. For example, as abortion gets liberalized and end-of-life decisions get liberalized, there's a lot of discussion about healthcare delivery that aren't really about medicine, are about human values, are about human histories, human culture. And the same is true if you think of public health ethics. During the recent pandemic, for example, there was a lot of discussion about following the science, as if there was some defined set of values that everyone would be supposed to follow, and that would be the values set by science. But the kind of speaking is rather meaningless because science doesn't lead anywhere unless there are some values that drive its developments and its applications. But these values, again, are a matter of human decision-making. And human decision-making depends on human values, human history, and human cultures. In the case of public health ethics, the issue is even more complicated because we are not dealing with individuals, but we are dealing with groups. And often there is a tendency of thinking of groups as a kind of monolithic entities where everyone is supposed to follow the same kind of policies, the same kind of guidance. But groups, like the public, is a very heterogeneous factor in public health ethics, and there are different kinds of values and history that need to be considered when we decide what kind of policy is the best one for a certain group. Again, this requires a humanities approach because this is about values, histories, and cultures.